All right. The title of my presentation is an ecological approach to the mental health crisis. Over the past decade, there's been much talk of the mental health crisis, emergency, or even the mental health epidemic. Calls to address this emergency seem to become more urgent and persistent every year. In a rare display of unity in our fragmented country, calls to address the mental health crisis come from across the socio-political spectrum, however different the ideas might be of response. Everyone from the economic elite and their corporate-owned media, as well as the politicians, to various grassroots organizations and progressive politicians, all have words to say about this crisis and believe there's an urgent need to address it. But what is the mental health crisis that has garnered so much attention? On the surface level, the mental health crisis refers to steadily rising rates of mental disorders, substance use disorders, and suicides. The rise of suicides is particularly striking as it cannot be explained away as an effect of the growth of the mental health professionals and increased mental health awareness and access. This is what some people have argued regarding the general rise in diagnoses. Additionally, typically not included in our statistics on suicide, but very much indicative of our mental health crisis today, is the rapid and mimetic growth of lone killers across the North Atlantic, and particularly in the United States, who tell us in their manifestos that they plan to die after their killing spree, with the intention of spreading a contagion of hatred across the social body. This sort of suicidal homicidality is certainly one of the most disturbing pieces of the mental health crisis today, as it points to the progressive loss of empathy and genuine self-love across the social body that are so pivotal for our social solidarity and our practices of resistance and care. Almost equally alarming, however, are the rising rates of mental disorders, specifically among our youth, with more severe diagnoses over time, as well as increased rates of adolescent suicides. In other words, mental disorder and distress are affecting people younger and younger, and in more intense, debilitating, and inescapable ways. These more extreme patterns of psychosocial alienation in the younger generations are also occurring alongside the near ubiquity of what we call attention deficit and panic disorders, disorders of the sensitive, overwhelmed, and overstimulated body. So, how do we understand this crisis? Of course, overdrugging and overdiagnosing contribute to the rising rates of diagnoses. And we must state clearly that the diagnoses themselves are social constructs, attempts at capturing observable expressions of psychic alienation and suffering. Yet this does not make the suffering not there or not real. I believe it's a grave mistake of some otherwise critical thinkers in the mental health field to write off the mental health crisis as simply an ideological reduction or a displacement of what is exclusively a social crisis. Yes, there's a social crisis, which we're going to discuss quite extensively, but we should never refuse to say emphatically that there is a serious crisis in our mental ecology and that this warrants the designation of an emergency. So, yes, we have a crisis here, but it matters tremendously how we talk about this crisis and how we understand it. And my suggestion is that, in contrast to the current biomedicalizing approach of the psychiatric establishment, which sees the crisis as separable from other social crises, we take an ecological approach. And the book Three Ecologies by the psychoanalyst and labor organizer Felix Guattari is foundational for me in this regard. In the book, he argues that the basic point is essentially that the mental ecology cannot be separated from the social or environmental ecologies that it's embedded within. This really brilliantly written book and the sort of ecological way of thinking put forward in it, however, was not necessarily the new invention of Guattari or of other European and American ecologists in the 70s and 80s, but rather we could think about it as a return to an older, more intuitive way of thinking. Gregory Cajete, a Tewa philosopher, writes in his book Native Science about the ecological and process-oriented approach of many indigenous people. He argues that a native science is ecological at its core and requires looking at everything as in relation and everything in process. The primary reality is relation and transformation, not complete and eternal objects. And now, this doesn't mean that we can't say anything about anything. It just means that we need to grasp phenomena, in our case, um, the mental health crisis or mental disorder, by the processes that solidify into configurations and then understanding their breakdowns, how new forms emerge in their overarching context, rather than focusing on the things themselves, seemingly split off from the rest of the world, which is characteristic of Western thought. Although today the social body is less and less capable of consciously and effectively controlling events, we nonetheless need to look to our social ecology first, our collective relations, in order to understand the current breakdown of environmental and mental ecologies. In other words, the mental health crisis can only be understood by first situating it in relation to a broader social crisis. This is because, while for the most of human history, there was more of a balance between our ecologies, a relation of reciprocity between humans and the rest of nature. Starting roughly around the 15th, 16th century, a new relation emerged, which we can call the capitalist relation, that began to subordinate the environmental and mental ecologies to the ends of production and profit accumulation. What we've come to call capitalism, rather than being sort of about a small state, a free market, or individual freedom, has always been about keeping people unable to sustain and govern themselves autonomously, so that they are forced into precisely calculated debts that must be repaid in money, and ultimately, therefore, being forced into wage labor. Now, no common people anywhere around the globe wanted this or accepted this transformation without putting up a fight. The dissemination of the capitalist relation was a long process of sort of viral infection that spread by way of violence and subordination of heterogeneous mental and environmental ecologies, a sort of growing social sickness, killing off of biodiversity as well as human cultures, recoding sort of all of this diversity into a single destructive logic. Um, a couple centuries later, what we refer to as modernity, starting around roughly the 18th century, we could say that it was marked by the spread and institutionalization of the destructive capitalist relation on the one hand, and on the other, marked by attempts by many humans and environmental processes at combating this with more democratic and human rights-based reforms and even thwarted or co-opted revolutions. Now, the inherently unstable result was the growth of what was called liberal democratic nation states across the North Atlantic. Um, but rather than representing anything truly democratic, it instead sort of solidified the supremacy of capital, the white race, and the male sex by offering securities and protections for the white male working class based on continued exploitation of the global South and the racialized and female body domestically. These nation states became like multi-headed egos, sort of mediating between the desires of working populations and the ruthless drives of capital to accelerate exploitation. And then fast forwarding to the late 60s and early 70s, a pivotal time that constituted the sort of defining climax of a tragic battle between democratic, egalitarian, and freedom impulses and the more raw capitalist relation, with the capitalist relation emerging victorious and the resulting statecraft deemed neoliberalism. Now, this was about using the power of the state to forcefully facilitate the unlimited growth of capital globally while attacking the idea that there could be any alternative and calling this democracy and freedom. This coincided with the depegging of the dollar from gold in 1971, leaving it with no physical referent, free to grow limitlessly, and banks given the power to create money out of nothing with a keystroke. After a period of intense nationwide strikes from organized labor, seeing tens of thousands of striking workers across industries, the unions came under direct attack by the newly elected Ronald Reagan, firing 13,000 air traffic controllers and sending a message that workers should not have power. Social services were privatized, cut, and fragmented, making them often lower quality, harder to access, more expensive, and leaving people more vulnerable, less able to sustain themselves, competing for worse paying jobs, spending more time than ever at work, and going into more and more debt just to survive. All the while, the capitalist powers of the North Atlantic, with the US in charge, were going about violently forcing the global South to hand over all their resources, to become extremely indebted to Wall Street, and to accept right-wing dictators, often funded and trained by the US. By the turn of the century, inequality had reached astronomical, literally quite unfathomable proportions. More capital and commodities were circulating the globe than ever before, while humans were less free to move, their communities and resources exhausted, trapped behind militarized borders, and less capable of dissent or the basic capacity to meaningfully reorient collective life. Regardless of this reality of exploitation, the so-called Democratic Party continued to claim democracy and equality as their signifiers, continued to consider themselves a party of the working class, all the while taking up the banner of global finance and empire around the world. This exploitation of our social body, while denying the abuse and equating it with freedom, was tantamount to a psychoticizing of our social body, with the 2008 financial crash being something of a psychosis triggering shock. Rather than recognizing that our social order was terminally ill and sending the economic elite to prison, those in charge of statecraft bailed out the bankers and the economic elite, gave them billions to expand their empires and rebuild the economy, all the while making the masses repay the debt. The democratic liberal nation states across the North Atlantic began to fragment irreparably. Old systems of representation alongside protections against the extremes of corporate and state power continue to fade away, alongside any last symbolic deference to liberal ideals, which are now openly contested by the fascists taking power around the world. This relation continues as strong and ubiquitous as ever, although increasingly faced with limits imposed by a multiplicity of state and non-state capitalist powers. Powerful states controlled by more powerful corporations, themselves often in conflict, sometimes with their own private armies, enter a new phase of violent imperialism to secure resources, territory, markets, all to sort of facilitate capital. At the same time, we have the growth of powerful techno-fiefdoms, as Yanis Varoufakis points out, who have the power to extract rents from other corporations and unpaid humans, and have the capacity to alter people's access to information and to shape behavior and perception. These sort of techno-fiefdoms have cozied up with rising fascist leaders around the world, using their vast technological power to shape political opinion and the perception of reality itself. All of this leads to the continued increase of chaos and violence today. We're witnessing and living through what decolonialist philosopher Amy Césaire called the imperial boomerang, where the violence that the North Atlantic unleashed around the world comes back finally to haunt us. Nature begins to fight back, sending fires and floods, melting ice and creeping deserts. Surveillance technologies and weapons utilized in the so-called war on terror return to our streets, which were already utilized against BIPOC communities, but the brazenness is heightened and their use extended to include the white working class and any democratic dissenters. We're entering what is considered by many to be a prolonged planetary civil war between the global economic elite and the rest of us, including the birds and the trees and the coral reefs. We have more in common, we could say, with the polar bear in the Arctic or the factory worker in China than any of us have in common with the elites of our respective countries. Already in the US, cities are starting to break away from the federal government, and communities even are breaking away from cities in certain places. People are setting up their own checkpoints, patrolling communities. There's no real way of returning to old forms of so-called democratic statecraft from the psychosocial processes that are now underway. These old forms are what birthed these new processes. And the only utopian thinking today, as many have pointed out, is the thought that things could just go back to how they were. We must situate the mental health crisis as emerging from this social crisis of an exploited, psychotic social body with unbound negative affects of fear, agitation, anger, and catastrophic despair. And this social body is one with limited frameworks for sense making, no real outlets for political participation, and overwhelmed with fantasies of collapse. How can we not panic and like really fall apart when we actually face the horror of the current situation? How can we scroll through our social media feeds, overcome with all of these hallucinatory fragments of news with no time and no frameworks for real processing, and then still fall asleep at night? How do we sleep through the night without grinding our teeth or without waking up with nightmares? How do we spend 90% of our waking hours dedicated to work and survival and not come home and displace our anger onto our loved ones or repress everything with Netflix series, alcohol, drug abuse? How can we not be enraged by our subjugation? How can we not fall to our knees to mourn the loss of bio and human diversity if we took a second to really process the loss of life, the extensive loss of life, the genocide, the ecocide, the isolation and fragmentation of communities? How could we not just break down in a depression that would counter the manic pulse of a deranged society? While psychopathology may still arise developmentally for some in the context of a family, the family itself is pressurized and fragmented by the social order, and the child is exposed from a young age through technology and experiences in the community to the collapsing world around them. The child becomes a stressed out adult by the age of 5 in a decaying world where futures appear everywhere to be limited to crisis and subjugation. When slowing down and looking at the world ecologically in this way, in this interconnected way, we must acknowledge that it is those who somehow slip by as normal and stable who might be considered more sick, those clinging to a sense that everything is fine, clinging to the center that cannot hold, as Ellen Sachs titled her memoir of psychosis. It is those who have managed to somehow not have elevated levels of distress that are paradoxically the more psychotic in the sense of relying on the most reality distorting defense mechanisms, or those who are most antisocial in the sense of relying on the exploitation of others to prop up their life of privilege. Thinking ecologically, it's impossible to continue to maintain that the mental health crisis could be isolated, extracted from the context of interconnected and deteriorating ecologies, and addressed as individual malfunctioning. This is, of course, exactly what the psychiatric establishment does, and the politicians and economic elite are quite happy with the arrangement. The real disorder here, though, is the social disorder, and it becomes unclear what we are to do from the position of therapists and crisis workers in such a situation, where adapting someone to the norm is subjecting them to a psychoticizing order of object usage. If we define disorder, as the medical philosopher George Canguilhem did, as a new rigid norm, holding people back from living or changing in desired ways, then adapting people to this social disorder that demands rigidity and subordination of their life drives um, to the profit of others and the destruction of the environment, then we're really just ushering people further into disorder, into social disorder, into psychological disorder. On the other hand, what we call individual mental illnesses can also be looked at differently, understood as attempts at refusal and escape from these unbearable situations, containing within themselves knowledge about the world that we live in and directions for potential escape. These are sensitive, creative, and ethical responses to the social disorder. By blaming the so-called malfunctioning individual on the level of their cognitions, neurochemistry, or genetics, and telling them they need to fix themselves to be better adapted to the social order, the psychiatric establishment takes what could be considered a paranoid, micro-fascist approach to the mental health crisis. The problem is not intimate, they say. It's not related to you. It is externalized, and the persecutory objects out there become the problem. And this is exactly our political moment. It's not us, it's the immigrants, it's the cultural Marxists, it's the feminists, It's those who are gender and sexuality non-conforming, and all of these bodies out there that are invading upon us, they must be eliminated. But this paranoid fascist approach of the state, of the psychiatric establishment, although seemingly internalized in genetics and neurochemistry, it's so far internalized that it's externalized in the sense that there's nothing you can do about it. It's actually not you at all. It's not us. It's not of our making. It has nothing to do with critical, psychological, and social conflict or the decaying. It is the disease, which is not you. And as such, its symptoms have nothing meaningful to say, and they must be eradicated. In the midst of our social psychosis, we can isolate what Deleuze and Guattari referred to as both schizophrenic and paranoid tendencies. The schizophrenic tendencies constitute new breaks in this sort of psychosis, with new flows and lines of escape that emerge from the rigid law and order is collapsing. Out of these new breaks and lines of escape, new potentials emerge for other ways of being in the world. On the other hand, paranoid tendencies attempt to capture the chaotic energy unleashed in collapse and to control it tightly by externalizing our intimate social conflicts into persecutory delusions that reterritorialize, securitize, and militarize the social body around the capitalist nation state. And the psychiatric establishment has become this sort of vast bureaucratic apparatus of surveillance and control that tends towards capturing new potential and subordinates this energy back into the social disorder, rather than encounters with the psychiatric establishment ushering in emancipatory ruptures that would facilitate the unfolding of new potentials and processes of sense making. Entrance into the psychiatric establishment tends to be the first step into a lifetime of chronic mental illness, maintained by the discourse, drugs, and fragmented nature of the psychiatric establishment, despite potential well-meaning individuals within it. The people doing the work of the psychiatric establishment are generally not a bunch of malevolent servants trying to repress potentials and subordinate people to capital, but tend to be some of the most caring people that I know. So, why do we continue to reproduce this approach? The answer is, of course, also the social disorder, the way that it subordinates even our attempts at caring for others to the dictates of competing profit motives, the way it triggers our defense mechanisms against the reality of its horrors, and by our own precarity and need for job security, which comes at the cost of people's suffering. The paranoid biomedical and cognitive behavioral models of externalization and attack, sold to us as the most evidence-based, coincided with the rise of privatized health insurance companies, healthcare corporations, and organized psychiatry. They marketed and lobbied this storyline and overtook education of psych workers at a time when psych workers were becoming more economically precarious and working in community clinics that were increasingly underfunded, understaffed, and overloaded with patients. This then has to be considered an integral aspect of the mental health crisis. It's not just that mental disorders are on the rise, but it's also that our response to this crisis, with notable exceptions, is to plug people into an illness-producing factory. The raw material of alienation is converted into individual mental illnesses that can be managed, maintained, and across the lifetime, many profits can be extracted. When politicians want to address the mental health crisis, it's to crisis work and more funds to the psychiatric establishment that they turn to, rather than saying we need a fundamental change in how we approach these crises. Of course, we need people to respond to the crises that capitalism reliably creates, but what should our response be? It cannot be a quick, individualizing, risk forward assessment before forcing someone or helping connect them to the psychiatric establishment. When a crisis team shows up, starts going down a list of assessment questions, some that have absolutely nothing to do with the situation. Do you smoke cigarettes? Do you serve in the military? Do you see and hear things that others don't? And then asking if they want to kill themselves or someone else. just a part of this long list of questions, when this also might have nothing to do with the situation. We show the person right off the bat that we don't really care that much about them or what they're really going through, only what they can be reduced to in an interview. And we show them that we do not have the time to understand their situation outside of a diagnosis and statistics for the state. The whole time, the patient, who, if they've had any interaction already with the psych establishment, is already wary of us, is now quickly shutting down the more we confirm their expectations. She's looking for a way out. Maybe she's slowly closing the door in your face, and we can't blame her. If there were any safety issues of concern, they've been withdrawn from the conversation. All they need to do is sign the safety contract being forced upon them so the workers in turn and the corporation can save their own butts. If a signed form exists in the system, that's all that really matters. No one can be sued. And if it's decided they need to go, this tends to be done away from the patient, as if it's a dirty secret, something terrible that's about to occur, and it would be best if they didn't have the heads up. But how are we in the first place to even determine that their depression or their psychosis is worse and not better and potentially more free and less alienated than taking psychiatric drugs and meeting with a personal manager so as to get back in the rat race? We need to respect what we see as the most severe manifestations of alienation, not in the sense of accepting them as the right way of being, but respect in the sense of relooking at them, to regard them as bold and inventive maneuvers on the part of the subject attempting an escape. Even with suicide, and I'm not advocating any sort of non-serious approach to a very serious issue, but we must be able to see in this a maneuver in a statement that is often assertive of agency. If I cannot live on my own terms, I at least have the power to take my own life out of the unlivable decay. It's also a refusal on a social level to participate in that which is destroying us all. And for this, it's dangerous to the social order and also reveals to others what an absurd world we live in. If we cannot respect this and cannot enter into the darkness with this patient, to understand this darkness and attest to it ourselves, then no safety will be developed. Safety comes through the possibility of a genuine encounter with something beautiful and striking, or by a unique meeting of sensitive souls in which what is important in the crisis or the symptom can speak itself, make itself known. And this requires a great tolerance of risk and uncertainty, something the psychiatric establishment is structurally incapable of. When thinking about crisis work and thinking about the mental health crisis more generally, we need to create spaces for slowing down, deepening and entering into experience with people, helping them to reimagine and reconnect, to create new ways of being outside of coercive productive apparatuses. And this means asking fundamentally different questions, not what's going to get someone back to on a world that's full of destruction. Not how can we get them to sign a safety plan, but what will help them refuse, escape, and create anew. What is the possible role, even here, of psychedelic substances in this regard? Substances that break down the default mode network, facilitate new neural connections, open up and intensify experience, creating new imaginations, in contrast to the dulling of emotional and cognitive capacities characteristic of many psychiatric drugs. And what sort of work can we tune into that's already underway in our so-called symptoms that we might learn from and work with? This is all not just a question for individuals in crisis, but all of us. We must see our own struggle of refusal, escape, and reinvention as bound up with that of our patients. Crisis work should be what opens up the knowledge and potentials inherent in the crisis and then plugs people into deep processes of psychosocial transformation, where they can carry out a work on what is already at work in them, not just turning people inward to their personal thoughts, family history, and genetics, but also outward toward social history, toward new social bonds and encounters with what is beautiful in the world. Mobile crisis teams, as first points of contact with the system for many people, have a major role to play in reorienting psychiatric work from the more paranoid fascist approach we've been describing of externalizing and attacking toward an emancipatory approach of opening up and deepening. This potentially truly important work done by crisis teams should not be separated from the rest of the municipal health system. but rather everyone in the municipal health system should share the responsibility of integrated crisis work. Crisis teams made up of inpatient and outpatient staff with weekly time set aside should operate as the first point of contact for those with severe episodes of mental illness and focus on meaning making in the context of a continuity of care and a multiplicity of voices. Following the open dialogue teams in Finland, they should meet with the whole network in crisis rather than just the so-called individual in crisis, all the way up until the resolution of the crisis-inducing situation. At the same time, crisis teams need to have access to a wide range of depth therapists and community centers involved in aesthetic activities and democratic movements that are disalienating and revitalizing. This would require citywide education campaigns to counter the long-lasting effects of decades of marketing by the pharmaceutical industry and organized psychiatry, as well as the stunting ideological effect of decades of neoliberalism, the time of no alternative. We need to be working to reorient our municipal institutions, those local institutions still capable of being returned to the people, reorienting them not around economics and the production of things, as David Graeber would say, but around the values of care and freedom. We urgently need to review our mental health interventions and institutions and judge them based on their capacity to free people from capital and state-based obligations and to connect them with autonomous social groups who are engaged in ethical and aesthetic activities capable of revitalizing the social body, building empathy and connection, and new ways of caring and sustaining local ecologies based in reciprocity and mutuality. This sort of work could happen at times in a hospital. I don't think the hospital has to be an irredeemable illness factory, but it will need to be freed from the competing profit motives and corporate bureaucracies controlling it, and our response will inevitably need to go beyond the hospital as well. We need to municipalize the health system and healthcare in general, bringing the patchwork of private and semi-public institutions under direct democratic control of local residents through patient worker assemblies and elected and recallable health administrators. It is also of the utmost importance that we collectively fund and guarantee healthcare for all, eliminating the destructive effects of private health insurance companies. And in the process of institutional democratic reform, we must return our attention to the soul of the world, as James Hillman was known to say, slowing down and taking in our environments that are alive with us and coextensive with us, and transforming the pathogenic elements of our environments that are inextricable from our crises. This is a very doable mission, but it demands cross-disciplinary organizing, uniting health workers and patients, community organizers, climate activists, urban planners, artists, and local politicians. The challenge is not the actual future institutional or environmental changes, but the fact that we've been made to be so fragmented from one another and so incapable of imagining new, more free and egalitarian worlds that are here, latent as potentials in our current social collapse. Our task is to heal our ecology by rebuilding a society worth being sane in. Mental health will return only with restored relationships with each other and with the living world. These changes can really happen. They can happen quite easily the more that care is guaranteed and the more that we take power back from the top-down structures that exploit us. In conclusion, we must start talking about the mental health crisis as inseparable from our social and environmental crisis. That is, talking about it ecologically. And we must work urgently together to address these interconnected crises at their roots. Either we build democratic power now, or we will face increasingly violent and isolated times in the future.